My name is Dr. Dianne Mani. I am a mom, wife, clinical psychologist, and coach to the modern mama. My passion is to help modern moms step into their true potential and reinvent themselves so they can live a life they absolutely love. I truly believe that every mom's journey is unique, and I want to inspire moms to own their journey and know it's possible to thrive. Together, I want us to reinvent motherhood. So this is why I'm so excited to bring you this series. Each week, I will spotlight a new mom who I believe embodies the reinvented mom. These women's motherhood journeys are all beautifully different, and they all agreed to share their insights and best advice with all of you to own your own too. So sit back, listen, watch, and enjoy.
Okay.
Okay.
Welcome everyone. This is the first interview for the Reinventing Motherhood Spotlight series. And I am so incredibly excited to be bringing on Dom today. Dom is a licensed clinical social worker and the owner of a private practice called Between Heartbeats. Her practice focuses in on helping parents of medically fragile children and women recovering from traumatic childbirth so that they can overcome trauma, grief, shame, guilt, sadness, and fear. So Dom and I connected through our business consultant and certainly connected very instantaneously. And the more that we got to know each other, we found out that, of course, we have this very unique connection. We are both the proud parents of NICU survivors who are NICU survivors of children who are medically fragile, and both of our kids are thriving. So certainly, Dom, I'm going to let you just introduce yourself now.
Thank you, Diane. So yes, I am a licensed clinical social worker with a private practice, and really Between Heartbeats is a nod to my medically fragile child, who is really the reason that I created the practice. And I actually have two NICU survivors. One was born premature, just a month old, but he still ended up in the NICU for about a week. And the second one was born only 15 months later and was diagnosed with congenital heart defects at 30 weeks gestation and ended up having open heart surgery at 6 days old, followed by 2 airway surgeries, and then was in and out of the NICU and PICU, which is the pediatric intensive care unit, throughout his first year of life with just any small virus just would send him into respiratory failure. So he was on an NG tube for the first 4 months of life. So it's been a challenging start to our parenting journey, but both my kids are doing really well now. They're thriving, they're growing, and we're very proud of them.
Yeah. No, I definitely hear all of what you're saying, because as I mentioned, of course, we had gone through that process too. And the NICU is this really interesting place that is both inspiring and scary all at the same time. You certainly learn so much about the medical profession. You learn who you are as a parent, as a person in general. I know that it changed the dynamic in a very positive way between me and my husband, as well as we kind of journeyed through this together. And, you were mentioning, of course, like even that process, like after they get discharged from the NICU, just kind of the following year or so after, just the in and out of the hospital, we went through that exact same thing. And still to this day are in that space of constant uncertainty, and so proud of our little survivor as well. But it's a crazy place to be as a parent, certainly.
Yes, definitely. And then all the doctor follow-up and physical therapy, all the follow-up procedures and the follow-up tests and lab work and everything. It's just a whirlwind of just taking care of this one little being, not to mention if you have other kids, or if you also have work, or your own self-care also, your own doctor's appointments, making sure that you're healthy and taken care of, so that you can be there for your little baby.
Absolutely. How would you say that this affected your motherhood journey?
It's been a challenge. I'm not going to lie. It's had its ups and downs. For sure, it's been a lot of learning to stay in the present and not become reactive with whatever news comes our way, focusing on the things that are in our control. Even if it's just sitting at the bedside and stroking whatever body part is uncovered from under all the tubes and wires and everything. Just focusing on how that feels, or watching the monitor and just counting how many heartbeats there were that were even and just perfect. So it's also been a lot of grieving of the firsts that come with becoming a new parent, where you get to hold your baby first, or where you get to breastfeed him, or when you bring him home. It's just going out of the NICU empty-handed, like being discharged yourself from the hospital, going home empty-handed was probably the hardest thing I have ever done in my life. So it's just a process of almost constant grieving while in their hospital of, you don't get to show them off to family. You don't get to, watch them start developing and picking up their head and crawling. So it's just a process of learning how to take care of yourself so you can take care of the baby.
Absolutely. What stood out to me with what you were talking about right now, of course, the grieving aspect of it, all of the kind of what you were expecting it to be like, especially so this was your second one going through that NICU process, and you had, although the first one also went there was still this aspect of things that you were able to do that you didn't get to do with your second one. So it's like this expectations in your mind, and you don't get those same experiences. You're having to like fight through, again, that I keep bringing up, like the appreciation of them living and surviving through the NICU, while at the same time, like you were naming the going home. I remember that being such a challenging thing. And I don't know if you had this experience, but I was kind of really trying to kind of keep with the expectations of the norm, meaning I went home and I was pumping. So I was trying my best to, of course, still do it so that I can give the baby, Hayden, the breast milk that they say is supposed to be the best thing. And yet also being told that he's probably not going to be able to use that much breast milk because he's going to need high calorie formula. And so all of these conflicting messages, but I remember, waking up at 2 a.m. pumping and crying because my baby's not there with me, and so all of those, I totally hear what you're saying about the grieving and just all of the mixed emotions that go into it. How has this created challenges in motherhood for you now?
Like you've already mentioned, it creates that constant uncertainty. It's like, even though now they're both, okay, and they're thriving and they're healthy, it's every virus, every, like, this pandemic's just been crazy, but every virus, every, like, even just is looking at their lips all the time to make sure that they're not turning blue. I think it's motherhood on steroids. Every normal motherhood worry, just magnified all the time.
Absolutely. Absolutely. I don't even think I even thought about the looking at our son's lips, when he was younger, he was sick so often. And so most of the time, in reflection, I think for the first 2 years of his life, because he was literally sick with either pneumonia, or he had RSV a couple times, he didn't even have a shirt on for most of the time, because we were constantly just watching his chest, like to make sure, you know, is there, what's the constriction looking like? What's the rate? And so it, like you said, like, I think that's the perfect like description. It's motherhood on steroids when it comes to like that anxiety that comes up.
Exactly.
I mean, you've now dedicated your career to helping parents who are going through this, and you know, who have gone through this. And so, tell me about that, and you know, what prompted that decision, and also how you take care of yourself as well.
Yes. And I think that is so important to make sure that parents do take care of themselves, because if the parents are not able to take care of themselves, they're not taking care of, they can't take care of the baby. The focus is on the babies, the children, right? They're the focus. And what I found in my journey is that I needed the extra support myself, and it wasn't provided to me in the hospital. There was a wonderful, wonderful chaplain who sat for hours with me just listening to what I was going through, but she didn't have the skills to really help me move through it and to not get traumatized. And so I remember one day just driving to the NICU and realizing that I was not okay, that I didn't even care if, you know, I got into an accident, or I didn't care that it was a beautiful sunny day. And that's when I was really moved to look for support for myself that's outside of my family and friends. So I found a wonderful therapist who I know she's told me has felt out of her depths trying to walk me through everything. And just at one point, I think I was seeing her 3 times a week because things were changing so crazy. And I'm just like, I need you. So getting that professional support really, I think, is what got me through. But also I did a lot of work on my own. Like when you're in the NICU, you tend to have a lot of time on your hands. Yes, you're with your baby, maybe holding them, but there's really nothing you can do. Like you pump every 2 hours, or you go out to eat, but otherwise you're just sitting there, either watching the monitor or trying to touch your baby as much as possible. Ways to support myself in the moment. And what I ended up finding was the emotional freedom technique, also known as Eft Tapping. And that, like, working with my therapist, along with just doing the work on my own, using Eft Tapping and journaling and breath work, really was what provided that kind of replenishment that I needed to keep on moving throughout the day.
Yeah, no, I totally understand all of what you're saying, and just this like crazy space of feeling lost, and being a therapist ourselves, this space of feeling very vulnerable and confused about the tug and pull. I don't know about you, but for me, it was the tug and pull of feeling like I should be strong enough. I should be able to get through this. I know all the techniques.
Right.
I know how to do all this by myself. And at the same time, not knowing how to do any of it, when my brain, exactly what you named, is totally focused on what's going on with Hayden, what's going on with Hayden, what's going on with that monitor, what's going on with that beeping, and what the doctor is saying. And so I just wasn't in the space to take care of myself. And so that reaching out for professional help was incredibly powerful for me. I know I needed that objective, kind of unbiased space to even just have time to talk about what was going on, and then to remind me of the skills and have me walk through that process with them, with their hand, because I sure as heck wasn't going to do it on my own while my brain was spinning out of control. And so I definitely appreciate that so much. You certainly named the EFT tapping. And so I am so excited because you have graciously offered to show everyone what that is, explain it, and give every mama a tool that they can start to use, not because they've been in the NICU, but because motherhood is crazy town and all of our emotions go all over.
Yeah.
So I'm going to let you explain it and then take it from here.
Sounds good. Thank you. Yes. So EFT tapping is a wonderful and simple technique that you can use at home, or in the NICU. But it basically goes off of the same idea as acupuncture and acupressure go off of, which is the meridians and the pressure points. And basically, you just go through a series of those points while making statements about how you feel or how you want to feel. And I'm sorry for the baby in the background if you can hear it. But so you start EFT tapping with what's called a setup statement. And there's a lot of diagrams, you can Google them, that kind of show you what all the points are exactly. And if you can basically lightly, and you can tap as fast or as slow as you want. I find that tapping faster helps to remove some of the more depleting emotions like anxiety or fear. And then tapping a little slower can help to anchor in the more positive points. And so you start with your setup statement on the side of the hand, just tapping and saying the setup statement is something very specific. So the formula for it is, even though I'm feeling this negative emotion, and you name whatever it is you're feeling, I deeply love and accept myself. And so you say that 3 times while tapping the whole time. And then you move through several rounds of tapping on all the other points that I'm going to go over in a minute. So you want to first tap on something that will trigger your, or like as I like to call it, activate your negative emotion. So if it's something like limiting belief or anxiety, or you're feeling fear or you're feeling overwhelmed, then you tap on that by just tapping through the points. And at a certain point, you will feel the emotion that you're tapping on shift, and it can either shift to a different emotion, it'll just lessen, it can disappear completely. And at that point, you want to start either continuing on until you feel a greater shift, or you want to start anchoring in something more positive. So right now, we're just going to do a round of tapping to anchor in our inner strength and resilience. But if I were tapping on overwhelm, I'd just go through the points, tapping on overwhelm or whatever comes up to about overwhelm, and until I feel a bit of a shift, and then I switch to something more positive like gratitude or compassion for myself. So I'm just going to walk you through all the points first, and then I'll do the meditation. Don't worry if you don't get all the points correct. It really doesn't matter if you miss a point. It'll still have a good benefit on your body. So the points are, again, side of hand, and that's only for the setup statement in the very beginning. And then you go on the corner of your eyebrow, right as it meets the nose, and then side of eye, under eye, just like right at your cheekbone, under the nose, under your lips, like right in the crook between your chin and your lips, and then the collarbone, just like right in that little dip underneath that angle of your collarbone, And then this is an awkward one because you're going to look like a monkey, but it's under your arm, right on your bra line for women. And then on the top of head, which makes you look even more like a monkey. So then you just keep going through the points for as long as you need to. And it can be something as simple as just saying, I feel overwhelmed. I feel overwhelmed. Usually you just tap for as long as, on each point, for as long as it takes you to say whatever statement you're saying. And there's a ton of scripts out there that you can use. There's a lot of YouTube videos with scripts. I do my own Tap With Me Tuesdays. Yeah, so that's basically it. So I'm going to start us off with a setup statement. Even though not everything in my life is as I wish it would be right now, I deeply love and accept myself. Even though not everything in my life is as I wish it were, I deeply love and accept myself. Even though not everything in my life is as I wish it were, I deeply love and accept myself. Now starting with the eyebrow point. Not everything is as I wish it were. There are some things I wish were different. Moving to the side of eye. With an under eye. I wish some things were different. Moving an under nose. But I am grateful for all the things that are even better than I had hoped. Under mouth. I am so grateful. Collarbone. I can see how far I have come in this life journey. Underarm. And I recognize my own resilience and strength. Top of head. Even though not everything is as I have hoped, I can still remain grateful. I know, moving to the eyebrow point, I know that I am strong. Side of eye, I know that I am resilient. Under eye, I can keep moving forward, growing and learning. Under nose, I can continue to show myself compassion. Under mouth, I can even love myself. Collarbone, I accept myself the way I am with everything I've experienced. Underarm, and I know everything will help me grow even stronger. Top of head, and I remain grateful for it all. I like to end with a deep breath. And there you go. That's your introduction to EFT.
I love EFT. So I thank you. Thank you so much for that. I think that was the most clear and simplistic explanation of EFT that I've ever heard, by the way. And I just appreciated, of course, going through that whole process. Yeah, absolutely. I think the beauty of EFT, as you were mentioning right now, was you don't have to tap really hard. You can do it as kind of whatever pace you feel is comfortable for you. And what I also had learned was it's a great technique to use anywhere, because it's one that, because it can be either tapping or pressure, you literally could disguise this. Like if you were out in public and you were feeling a bit anxious, literally just even holding pressure on those spots, and it just kind of being like I've got a little itch here and a little itch here. And, and even if you're just putting, I've got this thing I'm checking on my head, but all, like you said, it's such a beautiful technique because it is so incredibly effective and so simple. And
Yes.
so again, thank you so much for that. You kind of
You're
slipped in there,
welcome.
and I
My
just
pleasure.
want to reiterate it that Dom does a Tapping Tuesdays. So she is in Illinois. And so please remind me of the time there, because I am not good with that, as you know, with the time frame.
Yes.
But let us know
So
again a
we're,
little bit about that.
yeah. So every Tuesday at 3 p.m. Central Time, which is 2 hours ahead of Pacific Time, I call them Tap With Me Tuesdays. And basically I do a little bit of a education, and then I do a quick maybe 10-15 minute tapping meditation on different topics every week. And if anybody wants, that is available on my business page Between Heartbeats Counseling. And you don't have to be in Illinois to join, obviously, but yeah, they're just very quick tapping meditations. And I try to tap on a lot of the things that I see coming up over and over in the Facebook groups that I'm part of for parents of medically fragile kids. So I've tapped on like survivor guilt and just like parenting guilt, and I've tapped on a whole bunch of different topics. But it doesn't matter whether you can relate to a topic or not. Even if you just come along and tap, studies show that it can still have a very positive effect on you. So come along and tap, or go on YouTube, and there's a ton of YouTube videos out there with different tapping meditations. And it's really a valuable skill to have. And also a little tip in public, if you really don't want to like look like you're scratching all over, you can also just tap on the sides of your fingers. So just go through all the fingers and then the wrist. So you can just tap on the sides, which you can even do with like your thumb.
I've never heard of that one. I'm going to have to try that one for sure.
If you're going to do it in public.
Great.
Yep.
Okay, well, I am just going to give a humongous thanks to Dom, because again, she is incredibly sweet. She is clearly extremely knowledgeable and just so compassionate in the work that she does. I highly encourage you all to check out her Tapping Tuesdays. That is on, it's the business page on Facebook. And so tell us how we can get a hold of you. I will also, though, when I post this, certainly put all of the links for your business website. I'll put the Facebook group and everything, but what are other ways? What's the best way to get a hold of you if people are wanting to connect?
Definitely. So probably through my Facebook business page, which is again at Between Heartbeats Counseling. And I pretty much always have my phone by me. So either message me or comment, and I'm pretty quick to respond. So otherwise, you can get a hold of me by filling out the contact page on my website, which is betweenheartbeats.net.
Okay, well, wonderful. Well, thank you again, Dom. And we've certainly said, there's so much that we can talk about with NICU babies, supporting parents in that space. And so I'm sure that there will be another follow-up that you and I can maybe connect with and figure out in the future. But I appreciate you, and I hope you have a wonderful night.
Oh, my absolute pleasure to be with you and to do this for everybody. So definitely reach out, even just to say hi or give me an idea for a future tapping meditation. I'd be happy to do that. And yes, thank you so much for having me on this series, and I wish you all the best.
Thank you. Bye-bye.